Hello, I'm Dr. Akhavan, and in this short video I would like to discuss diabetes with you. Diabetes is a serious disease. But the starting truth is that complications of diabetes are preventable. You see, there used to be a time that diabetes was a death sentence. That is no longer true, thank God. Diabetes is the #1 cause of chronic kidney disease, but that can be prevented. Recognizing diabetes symptoms can help you prevent further devastating diabetes complications, so our job is to make sure that you recognize it in a timely fashion. If you're a person at risk for diabetes, this can help you to prevent it. Anyway, keep in mind that you may not have all the symptoms of diabetes. You may just have a few, or sometimes none. While talking about diabetes, you may be afraid, or you may think, oh God, what if I have this disease? Diabetes can affect the manner in which the body handles the carbohydrates, fats, and proteins. I know that's a lot of medical jargon, but what it means, it kind of disrupts your metabolism. If you neglect it, it can have serious complications. Just see how many times I've said that, so don't neglect it. Diabetic people have high blood sugar levels. The reason they get these high blood sugar levels is because the amount of insulin that they have in their body does not necessarily regulate or match the amounts that they need. Or it's that they have the right amount of insulin, but their body doesn't react to them. This disease is a condition where the body is unable to automatically regulate the blood glucose level, as I said. You want to know another fact that may just shock you? Is that this disease affects as many as 16 million Americans. That is a lot of Americans. So, you don't want to be one of them, and we don't want you to be one of them. So let's get together and prevent this problem. The first thing we want to do, I want to talk to you about some of the common symptoms that one might have as they develop diabetes. One of them is that you might be thirsty all the time. You got to be grabbing water everywhere. Or you might be going to the bathroom a lot with frequent urination. You may be going in the morning, all day long, at night, doesn't matter. You will notice that it's a lot more frequently than usual. Now granted, if you're drinking coffee or Coke all day, that may happen as well, but that will be a different problem. You might be hungry all the time, or you may feel tired. You may be just so fatigued. So those are some of the common ones. On the other hand, there are some other symptoms that patients may have, but these symptoms are a little bit usually more alarming because this means that these are symptoms of some of the complications of diabetes, which are that you may have blurred vision. Your vision might change. You might not see as well as before. Or you may have skin infections that they don't heal or get better as fast as they did before. Your hands, or your feet, you may feel tingling or numbness. Who knows, maybe there's also gum problems you may get, or maybe hair loss associated with it. Nonetheless, these are some of the complications that could happen as a result of diabetes. Many of my patients ask me, so doctor, which one do I have? There's two types, type 1 diabetes and type 2. Type 1 is also known as the juvenile onset diabetes. The reason for it is that your pancreas, as I said before, does not produce enough insulin. Now, type 2 diabetes, or adult onset diabetes, is basically your body's inability to respond to the insulin that's there. So, again, what happens? Your level of sugar rises. And that sugar basically circulates, sits on your nerves, sits on your cardiovascular system, sits on your blood vessels, and causes all these troubles. You got to know that type 2 diabetes is more common than type 1, and it is a lifelong disease. Something you should know is that type 2 diabetes is actually hereditary. Here's another thing you should know, is that type 2 diabetes may account for about 90 to 95% of all diagnosed cases of diabetes. Up to 2/3 of people with type 2 diabetes have no symptoms. Let me repeat that for you. Up to 2/3 of the people have no symptoms. That's why the screening becomes so important. That's why your annual physicals are so important, because that's what we do on those visits for you. When thinking about the risk factors for diabetes, obesity is the single most important risk factor for type 2 diabetes. Let me share another surprising fact with you, and that is an estimated 20% of all cases of new onset type 2 diabetes are individuals between the ages of 9 to 19. Now, I as an individual always thought that diabetes is a disease of the adults. But now, of course, after going through residency and then also, of course, in our practice, we see this all the time, that even teenagers now are starting to have diabetes. I mean, obviously, the ones that are obese are at much higher risk, but nonetheless, it is there. The more you know about type 2 diabetes, the more you're able to take the right steps to control your condition. Once again, I say, if neglected, diabetes can lead to various complications such as damage to kidneys, heart disease, nerve damage, and many other complications in the feet. It is our goal to detect and treat diabetes as early as possible. More importantly, at Casa de Salud, we would like to identify those people at risk and prevent its development or delay its onset at all costs with proper diet and exercise. We are here to make that happen for our patients. We are here to make sure that we detect them at the right time and we manage them with proper management.